Thank you all, and good afternoon. So I was really delighted to listen to some of the last questions, because usually when I come and I'm going to be talking about data, there's usually a very rapid attrition from the room. And it's particularly very exciting for those of us who've been working in public health for quite a few years to actually have that be very first and foremost in the questions that people are asking. And so I'm going to tell a little bit of a story about the approach that we've taken to integrating monitoring, evaluation, and quality improvement, both for action and impact. And this, I think, reflects a little bit about one of the last questions, which talked about how do you choose to measure and how much do you actually measure. So, as I said, this is a story of an evolution of an organization's relationship with data. So for those of you who may not know, and I don't actually go into this in too much detail, but Partners in Health has been around for over 25 years. It was started as an NGO working predominantly in Haiti by Paul Farmer and Ophelia Dahl. Since then, it's actually expanded to be working in a number of countries in Africa as well as working with other partnerships through other smaller NGOs to try to sort of share and expand lessons learned. As I said, I'm originally a clinician, and then through that went into quality improvement, and then through that ended up in monitoring and evaluation. And when I came about 6 years ago, I was hired as the first monitoring and evaluation person there. And there was a lot of really great work that was happening. There was fantastic photos, there were stories, there were some reports, but not a lot. There was a huge amount of data that was being collected and reported, because anybody who's ever had donors knows you have to do that, but much less of it was actually ever being used. And data was reviewed solely as a reporting requirement, and there was essentially very limited culture of data utilization. And finally, there was a very limited focus to capture what was working and identify and prove what was not. And that reflects one of the last questions, which is that, every dollar that you spend on monitoring and evaluation is a dollar taken away from patient care or the services you're delivering. And the argument that I hope I'm going to make for you guys is that actually isn't true, that a dollar you put into monitoring and evaluation often can save you more money as you go forward. So Bill Gates actually, if you sort of read in the Wall Street Journal in 2013, he said, "My plan to fix the world's biggest problems is from the fight against polio to fixing education. What's missing is often good measurement and a commitment to follow the data. We can do better. We have the tools at hand." And so I think the charge that we felt was, we needed to really move up to this, and it was good to hear that Bill Gates agreed with us. Now, this is the typical monitoring and evaluation information loop. And what you can see, I'm not sure, is that typically there's a huge amount of data that the site or the organization needs to feed up to the national or the donor, and there's very little feedback. If anything, there's usually absolutely no feedback. And this is a huge problem, because everything that's going up there, those are dollars going up there along with your data. Even worse, what we found is that there's a lot of data that's being collected that nobody ever even looks at. Nobody even looked at it. Again, it's wasted resources. So the question that we had was, how do we break this cycle, and then how do we actually move forward? And so to do that, we actually developed a framework. We said we have to build skills and systems, and we have to change the culture, which is probably the hardest thing to do. And to that, we sort of developed this idea of monitoring evaluation for action. And it was based on a couple of core thoughts that are really developed from quality improvement. We can improve what we do not measure. All improvement requires change. A great one, which is if we keep doing what we have been doing, we'll keep getting what we've always gotten. If you don't like the results you're having, you're doing it. Doing more of it, doing harder, doing faster is not going to actually get you to move forward. And finally, every system is perfectly designed to get the results it gets. So again, if you're not getting the results that you want to do, simply changing your staff is not going to work. You're going to have to actually change the system. So we used a thing of active program monitoring, and I like the idea of, if you're not going to make a change on it, then why should you actually bother looking at it? And so we have a continuous systematic approach where we collect and we analyze and we use the information. And very importantly, we provide regular feedback on change over time, and whether that's cost or personnel or anything like that. And we focus really on a range of different areas, and it has to be linked into action. So we also then do into that evaluation. I thought it was a really great point that was brought up, that you don't always have to have all these skills internally. We actually do, because we have a very close partnership with Harvard University and with the Brigham and Women's Hospital. But this may be something that you bring in, which is that if every once in a while you do what's called a deeper dive. You're really more limited in time. You might want to look at impact and effectiveness to be able to do that. It's really important, though, to actually do that for your bigger programs, to help them say what's happening, is it actually working? And again, this is the idea of focusing on the impact and how much does it cost to get to where you actually are. So the framework that we actually have is very simple. The first is that we have 3 questions that we first started to try to answer. How many, how well, and so what? If you can answer those 3 things, you're in pretty good shape. How many is sort of, monitoring. Are you actually doing what you said you're going to be doing? How well is more about quality. Are you actually doing it the way that you said you were going to be doing? And so what is really the outcomes and the impact evaluation. And then finally, we actually then integrated that in with quality improvement, which is utilizing the data, evidence-based decision-making, teaching people how to use the data to make decisions. And then finally, we started to look at cost. So how much did it cost? And finally, how was it done? So we can teach other people what we call the how and the why. So we've actually developed now this new platform where we say, some data still goes up, but we're going to actually empower people at this level. We're going to build their capacity to give feedback. We're going to try to, if you're not using it, as one of our people says, use it or lose it. We stop collecting it. And then we've built a lot of capacity for data to be used internally, as well as with partners who do quality improvement. And that's really the framework that we look at all of our data. It's got to fit into one of these, either this arrow or that arrow, or we get rid of it. Now, skills and systems, we also recognize that you can't just go out and do this to people. This doesn't work at all. And so what we did was we actually spent a fair amount of time and energy on strategic strengthening of data capture and management, mostly focusing on routinely collected data. We work in the public sector, so people are required to collect a lot of data, so we work to improve the quality of routinely collected data. We increased the capacity of people for data use. We actually increased the actual data use, and we did this through feedback loops and through supervision. And then finally, we actually changed our organization to be a learning organization that embraced data as opposed to being scared of data. This is just sort of some of the examples, and we do a lot of sort of very active workshops. You can tell in all of these, there's nobody who's actually sitting there listening to a PowerPoint like I'm making you guys do. Everybody's up, they're moving around. Nobody sleeps in any of it's one of our metrics, how many people actually slept in all these things. And so it really builds a community, and we actually bring people from the different countries so they can actually create a peer learning organization. This is also sort of the idea was that in the very beginning we had people coming in and teaching, and then we went and we actually taught people at the programs in the different countries to teach, and now actually we're sort of helping them to create their own trainers. And ultimately what we want to do is we want to build enough capacity that essentially the people in Boston are essentially out of a job, and that's our ultimate goal. So some of the skills that we've done is how to choose what to measure and what not to measure, which was a really great point putting up. We start very simple. We use logic models. What does success look like to you? How are you actually planning on getting there? And now we're expanding to some other frameworks, which people may know about REAIM or RIME or some of the other ones that we get from peers or from the literature. How to maximize utilization of routinely collected data. If you're collecting it for one thing, can you wring it dry? Can you make it used for 4 different things? Data quality has been a very big deal for us. And then we spend a lot of time doing data analysis and interpretation. Some of my team's in Haiti right now training on the use of R, which is a free statistical software program. Another group's just gone to Rwanda to teach people about how to create dashboards from Excel. So we're really trying to get people excited about how to actually use this as opposed to, again, data being foisted onto them. The culture is really important also, and it really goes to this fundamental question about why don't people do what they know works? And finally, why don't they respond to the results that you give them? You give them the report, you give them the dashboard, it's all reds, and they don't do anything with it. And we recognize that it's really a bit of a slow process and requiring culture change, and you'll see resistance. And we've learned a lot from the business culture on this. So whoever's getting the MBA, MPH, excellent idea. Resistance to change is really one of the key things that you have to figure out. And the idea is that it's really hard to start or to move change, and we recognize we want to do improvement, and we sort of said, well, we don't really have enough drivers, and we're actually understanding the resistors and barriers. And what we recognized is, here's this guy trying to move the elephant. You can either put more guys in place, or this is actually an elephant that we've put on roller skates to decrease the resistance. And you have to sort of be able to really identify what you can afford to do and what are the best ways of intervening. Because if you keep on creating the world's best report and nothing ever happens, it's not worth your time. The way that we've actually then summarized it, Don Berwick's probably one of the famous people from quality improvement, is he said there's sort of 4 stages of what he calls coping with data. And the first is when you show somebody the problem with the columns all red, this thing, he says, oh, the data are wrong. It's not quite right. And then they say the data are right, but it's not a problem. It's always that way. We always stock out of penicillin. We never have enough gloves. And then they say the data are right, it's a problem, but it's not my problem. You know, Lisa was supposed to actually have ordered the gloves. Not my problem that we ran out of gloves. And then finally, the data are right, it's a problem, and it's my problem. But we actually have expanded it. So the first problem that we had was that people didn't even know the data were being collected. What data? You're collecting data? Huh? So the first thing we had to do was to actually identify for people like what they were actually doing and then sort of walk them through this. And then these are all that have been added as we've sort of evolved over time. The data are right, it's a problem, it's our problem. Quality improvement's all about teamwork. It's never one person's issue. This was all about empowering people to change. You know, some people, after a while, they say, oh, it's always that. We can't change it. It is a problem. So it's our problem when we can change things. And then, we can change things, and we have started. So we've actually stopped talking about it. We're actually moving things. And these 2 were just added on by one of our country programs. It's a problem. It's our problem. We can change things. We have started, and things are better. So now they're actually effective. And then finally, not only are they better, but they've stayed that way, so sustainability and maintenance, and we are teaching others. And so this is now, we're going from an organization that was sort of like what culture, or please make that, what data, or please make that data go away, to an organization now that actually embraces the data, acts on the data, and is now teaching other people about what is and is not working. So the other thing that we've done, which has been really a lot of fun, is utilization of these data now, and then also linking with an academic institution and other organizations, so that we can incorporate new things. I have to say, mobile technology has been a little bit of a challenge for us, and was really interested to hear some of those stories. But this is an example in terms of driving gaps. So we recognized that we had issues around C-section, cesarean section coverage, and we used this, and then this was another one that had to do with access to primary care. And so we actually used GIS to map where all the different villages are. These are actually mapped by community health workers, and identified that there were areas where people had to travel too far. And as a result, sort of health posts were built. We did similar things for cesarean section coverage, where there's realization where an ambulance needed to be put. So you can actually take things which are not typically associated with use by an NGO, get somebody to come in and teach your organization how to do it. And not only that, but people really love looking at maps, and they respond to them much better than they do to monster reports or even to fairly colorful dashboards. So what about quality? People may not be too aware of this, but this is the building blocks that the WHO says you have to address all these things to strengthen health systems, and quality is really critical in all these things. And if we look at where we measure quality, we measure it at the systems, but we also measure what are people doing, and is it making a difference. So we're already back down to the how many, how well, and so what. We also, though, at Partners in Health, believe very strongly that we have to get the consumer involved, and there was a lot of discussion about how do you actually engage the community. Ask the community, you know, do you consider this quality? Is this what you're actually doing? And then finally, because we're very much a social justice organization, we believe in equity, which is if you're treating 90% of the population and the 10% you're not treating are the most vulnerable, the furthest away, the poorest, you're actually not delivering quality care. So the other thing that we're always trying to do is to adopt and innovate, so I always come here and listen for new things that we can learn about. This is, again, something that we got from business. This is a very simple dashboard. We were feeding back 150 pieces of data to health center directors, and they never looked at it. And when we actually broke it down into this, they could really see, oh, yeah, gee, you know, this area is not doing too well for anybody, and this is where we need to go. So just in terms of summary, I think it's been very exciting for me to have seen the evolution of monitoring and evaluation and data really as a component of global change. It helps programs and providers understand the successes and address their challenges, facilitates data-driven decision-making, expands understanding of what actually works in the real world in terms of impact and also how you actually got there. And very importantly, it empowers the people in the programs. But I think very importantly, and it gets back to this issue about how much do you spend on it, it needs work to help make it happen and to sustain it. And I think much about how to do that effectively is still in development, and I sort of will look to all of you in terms of where the next steps are of how we do it more efficiently, more effectively, and continue to get people excited about data as one of the most effective tools that we can use to help change the world. So thank you very much.